When you have a person who has a catastrophic or a serious illness, such as cancer or something like that, like my mom was just diagnosed with, you can reach those lifetime caps very quickly. Her first hospital stay was $35,000 for 6 days, and she now has had, 2 other hospital stays since. So a person could reach that cap very quickly with a disease such as this or any others. We need to make sure that those people are protected too. There are a lot of kids, and then of course, even as adults, we're getting to the point where our parents are reaching the age where they are developing more health issues, and we need to make sure that just because they have a health issue that they're not going to lose their coverage. Because you can very easily have a student who has a major health issue, and if they have a lifetime cap because of that, you're talking about a child who's maybe 5 or 6 years old who could reach their lifetime cap. And then what are you supposed to do, if you're the parent of that child for the rest of that child's life? Not get them insurance or get them the health care that they need in order to survive? There are diseases and conditions out there that are debilitating, and we need to make sure whether it's an older person or if it's a child, that they have the coverage that they need and that they get the medical attention that they should have and deserve. That's been a huge issue in the past, and we just can't allow people to lose their coverage just because they wind up being sick. We just can't.
Well, I think it's one of many positive steps forward in this new health care bill. And as the parent of 2 daughters, one already a young adult, another who will soon be there, of a 21 and 16-year-old, the ability to be able to extend insurance to them to the age of 27 will be a great plus for them and for our family. To develop a career takes time today, and at 21 we can't be assured that they're out of the nest. So to have time to be covered by health care will be a real positive for all of us and for every family in the state, not just mine. In the coming years, as the new federal law begins to be implemented in the states, it's going to be very important that we are following it very closely, that we're pushing for the legislation and the departments who will be carrying out the law to be carrying out to the best ability. So we're assured quality care and access to care for even more and more of our members. Elections on the state and the federal level are going to determine how this law gets implemented. So everything from your state member of the Assembly or Senate to governor to your member of Congress and the United States Senate. All of these offices will be continuing to take votes in the months and years ahead. They're going to determine whether this law is implemented in a way that's to the benefit of our members and the people across the state, or to try to block that and just look at the interests of the insurance industry. So the elections will be crucial when it comes to health care, along with our need to maintain quality education and get the kind of funding we need for our schools.
We made a very good start on the list of things that we need. I think we started with a lot of the very important ones, things that we need to get in quickly, such as removing the cap and making sure that people can't be denied coverage. But there are still other components that we need to get in place. We need to make sure that our legislators and our elected officials keep what has already started in this process and add to what we can do for people in this country for health care. There are many more things that we can do to help make this benefit even better for everyone. Like I said, we've taken a small step. We need to keep growing on that step, and we have to keep on our local officials in order to do that, our elected officials in order to do that.